Potentially 2 million Tennesseans could be impacted by a new plan to repeal and replace the Affordable Care Law. Governor Bill Haslam is among 14 other GOP governors who sent a letter to Senate Leader Mitch McConnell supporting what is called the Graham-Cassidy bill to repeal and replace Obamacare. A key part of the bill is giving states like Tennessee block grants of federal money to run Medicaid programs. Nearly 2 million veterans in the U.S. depend on Medicaid for their health care, and one of them is Kelly Gregory. This is what she told Tennessee U.S. Senator Lamar Alexander's office.
I told the young lady that answered the telephone that I was a terminal cancer patient, a veteran who relied on Medicaid, and that if this bill was passed, I would lose what little access I had to health care and that it would hasten my death.
Senator Alexander released a statement Tuesday saying he would like to vote for the Graham-Cassidy bill because he says he likes block grants and it would appear to be good for Tennessee. Republicans are making a last-ditch effort to repeal and replace that Affordable Care Law before an upcoming deadline makes it harder to push through.
Molly Lange reveals the details of the latest proposal.
President Trump says he thinks the Senate has a very good chance of passing a bill to repeal and replace Obamacare.
I think there's tremendous support for it. I think it's actually much better than the previous shot, which was very sadly let down.
Republican Senators Lindsey Graham and Bill Cassidy co-wrote the plan. It would eliminate the subsidies that make health insurance cheaper for people under the Affordable Care Act, and it would give states a lump sum of money to create their own health care systems. But the Graham-Cassidy bill still has provisions which some Republicans object to. Conservatives don't like that it would keep some of Obamacare's taxes.
We keep the taxes in place, but we give it to different people with more flexibility.
While some moderates are opposed to the idea that people with pre-existing conditions could end up paying more for health care, and it would end federal funding for Obamacare's subsidies and expansion of Medicare.
It would result in Maine receiving $1 billion less in federal funding for health care over the next decade.
Right now, Republicans need only 50 votes to pass the plan instead of the normal 60-vote threshold in the Senate. But that legislative tool that allows that lower vote is about to expire.
If we were going to go forward, we would have to act before September 30th.
Vice President Mike Pence says the Trump administration is all in to pass the bill. He stepped out of a meeting at the UN to talk with Mitch McConnell about health care. And President Trump tweeted this morning, "I hope Republican senators will vote for Graham-Cassidy and fulfill their promise to repeal and replace Obamacare." Mola Lengi, CBS News, Capitol Hill.
Republicans can only afford to lose 2 votes and still pass the bill. So far, Kentucky Senator Rand Paul says he cannot support it. Several others remain undecided.